Picture this. You're out with friends, enjoying a movie, when suddenly the urge to pee hits. Not a gentle nudge, but an insistent, I can't hold it any longer kind of urge. Frustrating, right? Many people experience this very scenario regularly, and it's often due to a condition called overactive bladder. It's not just about inconvenient bathroom breaks. This urgency can disrupt your sleep, make travel stressful, and even hold you back from social gatherings. The good news? You don't have to suffer in silence. Understanding overactive bladder is the first step to finding relief and taking back control. Let's delve into what causes this frustrating condition and explore practical ways to manage it. Overactive bladder, or OAB, isn't a disease itself, but rather a group of symptoms that indicate your bladder muscles are contracting involuntarily. If you have OAB, you aren't receiving gradual warning messages that your bladder will soon need to empty. Instead, your detrusor muscle gets incorrect signals from your brain to contract immediately, even though your bladder may not be full. When your bladder contracts, you feel intense urgency. So, what causes these rogue contractions? This may be due to overactive detrusor muscles, poor communication between brain and bladder, neurogenic causes, hormonal changes, especially after menopause, and bladder irritation or inflammation. Sometimes, it's linked to nerve damage from conditions like diabetes or multiple sclerosis. Other times, it's related to weak pelvic floor muscles or even certain medications. In many cases, however, the cause remains unknown. Recognizing the key symptoms is crucial. Besides the hallmark sudden urge, OAB often involves frequent urination, going 8 or more times in a day. Another symptom is nocturia, which means waking up multiple times at night. Most people can sleep for 6 to 8 hours without having to urinate. Last symptom you can check is urge incontinence, which means leaking urine before reaching a toilet. These symptoms can significantly impact your quality of life, but effective treatments and lifestyle changes can bring welcome relief. Overactive bladder is remarkably common, affecting millions of people worldwide. In fact, studies suggest that roughly 33 million adults in the United States alone experience overactive bladder symptoms. That's about 1 in 6 adults. Despite its prevalence, OAB often remains a taboo topic, shrouded in silence and embarrassment. This reluctance stems from a mix of shame, fear of judgment, and the misconception that it's just a normal part of aging. However, it's vital to remember that OAB is not something you should simply accept or endure. Openly discussing it with your healthcare provider is essential for receiving an accurate diagnosis, exploring available treatments, and regaining control over your bladder health. Did you know that what you eat and drink can directly impact your bladder? Certain foods and beverages act as irritants, triggering those bothersome OAB symptoms. One of the biggest culprits is caffeine. Found in coffee, tea, chocolate, and even some medications, caffeine is a stimulant for the bladder lining receptors, meaning it increases involuntary contractions of the bladder muscle. Alcohol is another common offender. It boosts urine output and can also irritate the bladder lining. Acidic foods, such as citrus fruits, tomatoes, and spicy dishes, can also exacerbate OAB symptoms in some people. Artificial sweeteners, found in diet sodas and processed foods, are often linked to bladder irritation as well. And let's not forget carbonation. Those fizzy drinks might be refreshing, but the bubbles can spell trouble for your bladder. By becoming aware of these dietary triggers and making mindful choices, you can significantly reduce OAB flare-ups and regain control over your bladder. Now that you know what can trigger your symptoms, let's talk about how you can take back control. The bladder is a muscle, and just like any muscle, it can be trained. Let's start with bladder retraining. When the urge hits, try to delay urination by 5 to 10 minutes. Over time, gradually increase this interval. The goal? To stretch out the time between bathroom visits, aiming for every 3 to 4 hours. Next, there are pelvic floor exercises, also known as Kegels. Contract the muscles you'd use to stop your urine flow, hold for 5 seconds, then release for 5 seconds. Repeat this for 3 sets of 10 reps each day and make these exercises part of everyday life. A 2018 review in Neurology and Urodynamics found that pelvic floor therapy significantly improves bladder control without the need for medication. But if lifestyle changes aren't enough, don't worry. There are medical options. First-line medications include anticholinergics, which relax the bladder, and beta-3 agonists, which help increase bladder capacity. Side effects can include dry mouth, constipation, or high blood pressure, so it's important to consult your urologist. For stubborn cases, minimally invasive treatments like bladder Botox, posterior tibial nerve stimulation, or sacral neuromodulation, a pacemaker-like device for your bladder, can make a big difference. These options are effective for drug-resistant cases and have high patient satisfaction rates. There are also natural remedies and daily habits that support bladder health, such as avoiding constipation, maintaining a healthy weight, and quitting smoking. Even simple practices like mindfulness or meditation can help, since stress is a common trigger. Remember, overactive bladder is common, but it's not something you have to live with. Whether you start with diet, exercise, or medical support, you can regain control and live life on your terms. If you found this video helpful, give it a like and share it with someone who needs this. And don't forget to subscribe for more science-backed health tips.